Inappropriate prescribing is a common problem in the drug treatment of older people throughout the world. It's important because it predisposes to adverse drug reactions and adverse drug events with serious consequences for older people, as well as increased healthcare utilisation, which is costly. The StoppStart criteria were first drafted and refined by me and my research team at the Cork University Hospital here in Ireland. The aim was to draw up a list of important, potentially adverse drug prescriptions, both common and not so common. The list was laid out according to physiological systems as one sees in drug formularies, and this was to provide a structure to the criteria. We also felt it was important to give specific mention to common and important instances of potentially inappropriate prescribing situations in older people. For example, the use of certain drugs that increase the risk of falls in older people with a history of recurrent falls. We also included a specific criterion on the use of duplicate class prescriptions, for example, giving 2 proton pump inhibitors or 2 beta blockers, which is clearly inappropriate in almost all cases. In addition to the list of instances of potential errors of drug prescribing in older people, the STOP criteria, we drafted a list of potential errors of prescribing omission, the START criteria. The START criteria refer to common and important instances of drug omission for irrational or ageist reasons. By the way, STOP stands for Screening Tool of Older Persons Prescriptions. START is an acronym for Screening Tool to Alert to Right Treatment. The new criteria are evidence-based and have been validated by a panel of 18 experts in geriatric pharmacotherapy in Ireland and the UK. The StoppStart criteria were published in early 2008. Since then, a great deal of research has been done internationally using the StoppStart criteria. Our own research group here in Ireland has shown a number of very important findings, such as, firstly, that potentially inappropriate prescribing in older people is highly prevalent in all clinical settings, from primary care to hospital care to nursing home care. Second, potentially inappropriate medications, according to the STOP criteria, are significantly associated with a higher incidence of adverse drug events in older people in hospital. These adverse drug events are, to a large extent, preventable according to accepted preventability criteria. Thirdly, StoppStart criteria, when used prospectively in older people who are hospitalised with acute illness, significantly improves medication appropriateness compared to standard pharmaceutical care. This improvement is sustained for several months after application of the StoppStart criteria at a single time point. Other research on the StoppStart criteria indicates that if used as a screening tool, StoppStart has the potential for saving very large amounts of money by helping prescribers avoid inappropriate medications that are either wasteful or unnecessary, or that are potentially dangerous and likely to make older people sicker rather than better. I must emphasize that StoppStart explicit criteria are not designed to capture each and every instance of inappropriate prescribing in older people. This is the function of drug formularies. Equally, StoppStart criteria are not meant to replace sound clinical judgment. Rather, they are designed to assist and enhance it. It gives me great pleasure to introduce you to the first commercially available version of StoppStart software, produced by Clinical Support Information Systems here in Ireland. This is the culmination of a research collaboration involving clinical gerontology and therapeutics, clinical pharmacy and computer science disciplines at University College Cork, with commercial partners at Clinical Support Information Systems. I hope that the use of StoppStart criteria will be helpful to you and your older patients in your day-to-day clinical practice, whether you're a physician, a pharmacist, or a nurse prescriber. Those with responsibility for drug expenditure budgets may also be interested in the StoppStart criteria as another means of improving value for money. We here in Ireland have been stimulated by the development of the StoppStart criteria as a clinical tool, now available as a software product. I hope that you, the user, will find StoppStart software not only stimulating, but useful and practical in your routine management of your older patients' drug therapy.